Hi friends, welcome to Fast Coder 21. In today's session, we are going to learn ICD-10 CM latest updates effective from April 1st, 2023. As most of us know, last year CMS has decided that from now on, every year we have two updates in ICD-10 CM. First one is in April and second one is in October. So in this session, we are going to learn April 1st, 2023 updates. So from April 1st, we can see 34 additions, 7 deletions, and 1 revision in ICD-10 CM. So you will get the file set cdc.govit. So if we see here, we have the financial year 2023 ICD-10 codes are to be used from April 1st, 2023 through September 30, 2023. So next October 2023, we will have updates. In April 2024, we have new updates in ICD-10 CM. So this replaces the financial year 2023 October 1st release. So if anyone wants, you can go to the cdc.gov and please download all these guidelines. All we have PDF, XML, and all the description files, and we have conversion table also here, and also we have present and admission exempt codes. So if we check in the guidelines, so here they have mentioned financial year 2023 updated April 1, 2023. So every year we are going to have two updates. First one is in April, second one is in October. So but we will use these guidelines from October 1, 2022 to September 30, 2023. So mostly there are no changes. Most of the changes in the 19th chapter, 20th chapter and 21st chapter. Those we are going to learn clearly now. Guys, if you want to know latest updates in medical coding, please subscribe to FastCoder 21 and also like, share and comment. So now we will learn chapter changes. So chapter 19, injury, poisoning and certain other consequences of external causes S002-288, we have 12 now new codes. Regard confirmed or suspected financial abuse. So we have in chapter 19, we have 12 new codes. Anyway, we are going to see those new codes. These are regards to confirmed or suspected financial abuse. And also in chapter 20, external causes of morbidity V002Y99 series, we have 15 new codes which are regarding maltreatment and neglect. And in chapter 21, we have factors influencing health status and contact with health services Z002 Z99. New codes regard the following. So one new code covers problem related to health literacy. So two new codes covers problem associated with the physical environment. They include essential services unavailable in the patient's physical environment and other issues with the environment. For example, these codes apply to a lack of sanitation in the patient's home. So for those, we have one code now. Four new codes cover inadequate housing, including issues involving the environmental temperature within the housing, inadequate housing utilities, unspecified inadequate housing, and other inadequate housing. So four new codes cover history of various types of abuse. So in April 2023, we will have four new abuse codes. These personal history codes apply to child financial abuse, intimate partner abuse in childhood, adult financial abuse, and intimate partner abuse in adulthood. And also we have four new codes cover patients non-compliance with medication or renal dialysis due to financial hardship or any other than financial hardship. So here we will check all the new codes. So if we check T series code, adult financial abuse, child financial abuse, adult financial abuse, child financial abuse. So two codes are confirmed diagnosis, two codes for suspected. So we have different codes for confirmed abuse and suspected abuse. So next one is husband current perpetrator of maltreatment and neglect. So this is current husband. Next one is former husband. Even we have two codes for wife current and wife former. So we need to check the documentation in order to code properly about this current or former husband or wife. And also we have male partner current and male partner former. And also female partner current, female partner former. And also we have non-binary partner current, non-binary partner former. So these all codes related to abuse. Here child proprietor of maltreatment and neglect, grandchild, grandparent, parental sibling, acquaintance or friend, perpetrator of maltreatment and neglect. So basically these all are related to abuse codes. But we have here current husband, current wife, like former husband, former wife, male partner, female partner. Like that we need to check the documentation in order to find whether perpetrator is current or former. So if we check remaining codes, Z55.6 for problems related to health literacy. So if the patient can't able to read or write, it will lead to Z55.6. Next one is Z58.81, basic services unavailable in physical environment. 58.89, other problems related to physical environment. So we need to check. For example, if you find inadequate housing, we need to code Z59.10. So if we found inadequate housing utilities, we need to code Z59.12. And also few changes for personal history also, like for abuse. So see here, personal history of child financial abuse, intimate partner abuse, patient's other non-compliance. So these Z91 series is for non-compliance with medication regimen due to financial hardship, and next one is regimen for other reason, and third one is related to dialysis. So Z91 151, patients non-compliance with renal dialysis due to financial hardship. So here it is related to medication regimen. Here 151 related to dialysis hardships. So patient non-compliance with renal dialysis for other reason, personal history of adult financial abuse, and personal history of adult intimate partner abuse. So in order to find clarity and specificity, we need to check the documentation properly. So these all are added codes, like we had 34 new codes, and now we are going to learn deleted diagnosis codes. So CMS will delete 4 codes regarding maltreatment or neglect perpetrated by a husband, wife, male partner or female partner. So new codes in chapter 22 we already read, replace these codes. So CMS is deleting 4 codes and they are adding 4 new codes. The new codes specify the perpetrator is current or former spouse or partner. So we have seen previously. So and also CMS also deleted code for inadequate housing. CMS will replace this with the expanded codes in chapter 21 regarding inadequate housing to further specify if she the housing what is the reason for inadequate housing regarding, like, because of environmental temperature or inadequate housing utilities. So we need to check the documentation. Also CMS deleted codes to apply patients non-compliance with medication regimen or renal dialysis, and they have deleted these codes but they have expanded in chapter 21 as we have learned previously, like medication regimen and dialysis regimen due to financial hardship. So now we will then revise the diagnosis codes. So CMS is revising the codes for material maternal hardship include due to limited financial resources not elsewhere classified. This code describes when a patient cannot obtain adequate childcare, clothing, utilities or other basic needs due to financial hardship. So previously, like before April 2023, this description is Z59.87 material hardship, but they have CMS have revised this code. Now effective 2023 April 1st, this codes we need to read as material hardship due to limited financial resources not elsewhere classified. So guys, there is no need to worry about these guidelines. These are very few only, and that also not related to chapter 1st to 18. Mostly these are related to 19, 20 and 21st, but we need to have a good idea about what are the changes we come across effective 2023 April 1st. Thank you guys. Thanks for watching Fast Coder 21. If you want latest updates in medical coding, please subscribe to Fast Coder 21 free medical coding YouTube channel.